Did you know that the healthcare expense tied to employment actually come from World War II? This accident is now affecting millions of healthcare expenditure. Let's discover today how to leverage technology to break down the set options that employers feel like they only have one or two choices when it comes to the benefits. And how can we create a design of health insurance that is tailored to the patients and caregivers?
Welcome to Provider's Edge, the podcast that helps healthcare entrepreneurs and innovators break down barriers and control their business, life, and future with valuable action steps. With me, your host, Sabrina Runbeck, a recovered clinician and a business deal catalyst. Let's rewrite the rules and create a positive social impact while increasing your profitability. Hey, it's Sabrina Runbeck, your host. I can't wait for us to have this conversation with Jason Spacek. He is the VP at Berkeley OkRP Health Innovations with more than 20 years of experience in telecom and healthcare. Now, I know some people really misconcept how we consider what healthcare is. And there is a shift as we looking into more preventative, more capture, leveraging data, technology to integrate better solutions. And then that means reducing costs from the payer side, reducing costs from the hospital integration side. Lots of benefits. But again, it's a big topic and a lot of different hands and forces to join together to make things work. So Jason has been leading strategic consulting to create human-centered, very aligned with us, market-ready healthcare solutions through empathy, innovation, and operational excellence. And especially, we all seek operational excellence, but most time, that is the most difficult part, to have the right people, the right system, the right dots, and bringing the innovations view to something that's tangible and actually applicable. So we know there are amazing projects they have been doing in Kansas City and in Phoenix. So I cannot say more amazing things about you. So I'll let you take over. So what do you think is some of the bigger challenges that we are seeing with some of the misalignments in the healthcare space that we're all making changes. We're all working toward what's better in healthcare. But how come it is so challenging for us to making strides?
Yeah, well, thanks, Sabrina. It's great to be on with you. And so I think the biggest challenge that we see from our vantage point, and we get the benefit of working with payers, providers, digital health companies across the landscape. So we kind of form a really interesting point of view from all of that work. But I think the biggest thing is just the misalignment of incentives is at the root of a lot of these challenges, right? And we all see this in our day-to-day lives, right? Where, a payer might be incentivized from one direction, a provider's incentivized for another direction, right? And the poor patient is often caught in the middle. And so with a lot of the work that we've done, specifically in bringing payer and provider together in some unique ways, we've been very thoughtful about how we've started to align those incentives beyond even what you tend to see in value-based care arrangements and things like that, and really kind of rebuilding the model from the ground up. I think another challenge that you see a lot is you start to see these things start to stack on top of each other, right? And so you get this incrementalism approach to healthcare innovation, right? Where a new platform, a new tool, a new capability is stacked on top of what's already there. But if the underlying fundamental foundation of it is not working well, all these extra things just can add to the chaos and confusion. And so that's one of the things we work a lot with to try to eradicate and improve upon.
Yeah, bring back even just, I think we all heard about value-based care, but it seems like there's a lot of misconceptions about what that really is and how to make that work. So explain a little bit more about that and how you guys play into that role.
Yeah, I mean, value-based care, what we're typically familiar with as consumers or practitioners of care is a fee-for-service model, right? Where I do a service for you, I get paid for that service. There's a rate for everything that I'm delivering, and the member, pays then the benefits. The benefits pay for that, and then the member pays on top of whatever's left at that point based on how their plan is structured. Value-based care kind of tries to take that to the next level and says we may still do some of that fee-for-service piece, but on top of that, we're going to create, incentives for the practitioner based on quality metrics or how well you're doing screenings for your members or how well you're working on the total cost of care and things like that. Some of what we've started to do is actually break that down even further and say we're going to actually kind of go a step further and get into more of these capitated type of models where the primary care in this case piece is already paid for within the structure of the health plan. And so the member in that case doesn't actually even have to pay out of pocket for their primary care experience. And the practitioner in that case, one of the biggest innovations we've seen from this is the practitioners' lives get a lot easier too when you can start to do that. Because now if we start to have this capitated model, they're paid for all the members that are aligned in their panel. And now they no longer now have to bill for these individual services. And they can actually practice medicine the way they went to medical school to practice it, which is just to think about what that member needs. And they can get into more proactive care, right? The biggest challenge, we do a lot of research with the projects that we work on and a lot of human-centered design. So we spend a lot of time talking not only patients, but with practitioners as well. And one of the biggest things we talk to them about is, how well they focus on proactive care and getting out in front of things and following up with people who have chronic conditions. And sadly, a lot of them say, we really don't. We just don't have the time to, and we're not really incentivized to do that, right? Which is horrible to have to hear that, right? As a consumer and someone who obviously will one day need some of that care. But they just don't, the model is not set up for them to be thinking proactively, to thinking holistically about people's care. And so one of the things we're able to do in rebuilding these models is to create an environment where those clinicians can now that the incentives are aligned in a way that I can actually think about that. And I don't have to worry about, can I get someone in for an office visit and bill them for it? Maybe it's an email, maybe it's a check-in, maybe it's a proactive outreach. And so we're able to rebuild models in a way that, again, clinicians are really desiring to practice.
So when you say rebuilding the model, it's about how do you engage with both the patient side and the clinician staff and the whole team? How do we get these additional workflow into the existing behavior, right, that we're doing and doesn't feel like burden? Is that what I'm hearing?
For sure. Yeah. I mean, like, as I mentioned earlier, like one of the big challenges we see in healthcare today is this idea of incrementalism, of just things being layered on top of each other. What we did when we worked with Blue Cross and Blue Shield of Kansas City on a model that became SpiraCare that people can go check out. We actually rebuilt it from the ground up, right? So the project was called Start Fresh at the time because we wanted to start fresh. The prompt was, what if we had a blank sheet of paper and we didn't have any legacy, anything, and how would we rebuild this in a way that made sense? And the very first thing we did was we sat down with 13 millennials in their homes and talked to them about how they consumed healthcare and what they liked and what they didn't like and what was confusing and what was good about it. And from that, we were able to start extracting lots of insights and then set about, again, rebuilding what would a primary care practice start to look like that was woven together with a health plan that were both, again, intentionally designed to work hand in hand with each other for the benefit of that member. And so we started to rebuild it step by step. And we did lots of co-design work with members where they kind of came in and sat side by side to say, what should a check-in process look like in this environment? What should the actual in-clinic care experience start to look like? What kind of follow-up would you expect to have? What kind of people need to exist in between the plan and the provider to start to make this make a lot more sense for you and to be a lot more simplified? And so those were the types of things that we started to use as prompts to rebuild this thing again from the ground up. And so what we came out to market with, again, was this very intentionally designed transformative primary care practice that had lots of these component pieces in them, along with, again, a health plan that steered people into this practice, and again, all designed to work together for simplicity for the member, but also for the care team that was working there.
Right. And that's a huge component of successful customer journey, right? From the perspective of that caregiver and the patient, how are they experiencing the care that they need and want, and sometimes they don't even know they have the access to. And then also is you guys, as you do these market researches, these interview, taking these information, process, they analyze that, also give the organizational physicians and payer group to say, how do you then create the best workflow from your backend to support the people when they need help at some degree, and it doesn't feel burdensome and it feels easy. I think one of the big challenges that I've been talking to a lot of startups that we advise is that they feel like, oh, I built this platform, build this solution, this is great. My number one question is, how do you want to make sure it's easy, right? It's not just another thing. Because doesn't matter if you're can sustain it yourself, you're talking to the end users. If the adoption is not there, it's not easy. Even they hyped up the initial excitement of, yes, I want to use that, let's go. But it's not already integrated in the workflow. They have to log into different things or have to read a separate printout. Then it's going to take more time. And then eventually that behavior is not going to change and there's no adoption, right? And then I think even from an investment standpoint, we always see if that integration is not there, they're not likely to get that higher level of funding as their company is scaling. Do you see that as well?
Oh, for sure. Yeah. I mean, we do a lot of work with early stage startups as well, too, and digital health companies and the advising and brand and marketing work that we do with them. And one of the biggest things, one of our core philosophies is fall in love with the problem, not the solution, right? And so we see a lot of situations in healthcare where, to your point, people I've got a platform, I built this tool, I built this capability. And, our first question often is, well, have you validated that anybody actually wants that, right? And so what we try to really orient around is what are the problems that people are having out there? And then if you've got a solution or a hypothesis around how to build a solution for that, great. But let's not get the order reversed. It's very important to think first about what are the challenges. And again, that was our prompt with some of these vertically integrated projects that we've done is like, what is the problem out there? Let's really understand the problems. And only then can you start to build potential solutions for it. And then again, important from a human-centered design perspective is there are a lot of times we had hypotheses about what that solution needed to be, and the customers steered us away from that hypothesis, right? One of the biggest examples of that in the projects that we did in Kansas City and Arizona was we kept trying to infuse technology into these models, right? So let's build a digital check-in kiosk, and people are going to love that. And it's going to direct them right where they need to go, right? Well, the reality is people push back on those ideas time and time again because they wanted that human-centered experience. They wanted the humanity of healthcare, right? We always forget that healthcare is probably the most personal, experience that we have, from a business or a company engagement standpoint, right? And so people wanted that humanity. They wanted to be known and understood as a human being, right? And so they worried that if I go in and a kiosk is greeting me, right, I'm not going to feel connected with. And what if the kiosk malfunctions and sends me to the wrong exam room and doesn't notify the physician that I'm there, right? And so again, that idea of falling in love with the problem is core to everything that we do. And I think healthcare could really benefit from starting with that problem orientation as opposed to like, here's another solution that I'm going to throw into the pile.
Exactly. It's how do we view a perspective that as a problem itself and not feeling like, oh, I just need to simply come up with all the solutions. Because then if you think about going to these larger conferences and events, there's so many solutions that sounds alike. So how do you stand out even out there to compete? And perhaps you really should be very clear in the niche and the problem that you're actually solving and not feeling like you are boiling the ocean when very quickly we understand you're not there yet, right? So having that vision, ambition is great, but having that clarity on exactly what is the focus, exactly what is the product services, I think that give people a lot more trust and buy-in. So for you guys, I know you guys also work with so many different entities, and that's the exciting side, right, of playing in this multi-hand and multi-purposeful company. And so what is if you have to put a major value proposition on what you guys do, who is those people that you help, and what's the tangible value that you guys are also providing for them?
Yeah, I think the biggest thing that we do is we try to help, again, companies across the healthcare landscape. So payers, providers, right? Again, digital health companies, early stage startups, everyone included. We help those organizations, again, think differently about where they're going, right? And help them position themselves for success, right? And that could be, again, a literally positioning from a communication standpoint. Again, we sit, our health innovations team sits as part of a larger brand and marketing agency. And so we have lots of capabilities to be able to help you communicate your brand story and your value proposition and all those sorts of things. We do a lot of strategy work. Again, are you positioning yourself the right way? Are you after the right things? Are you pursuing the right opportunities? And so product design, solution design, experience design. So we have a pretty robust set of capabilities that we can bring to bear depending on the needs of the clients that we work with. So it's, again, as you pointed out, it's a lot of fun because every client brings a different and unique set of challenges, and we get to see the industry from a lot of different angles. And that adds value to the clients that we work with, right? Because having the payer perspective from a past client is going to help us when we're working with a provider. It might help us with a digital health company that's trying to sell into one of those entities. And so being able to have that point of view. And the biggest thing that we do is obviously talk to consumers. So at Barkley, we like to say that we know the modern consumer better than anyone. And that could be a business consumer, an actual consumer. And so by doing that, we understand healthcare from the ground up, right? And so we're not sitting in a tower theorizing about what it needs to be or trying to just put thought leadership out for the sake of thought leadership. We talk to the people who are consuming healthcare and then can use those insights to serve the clients that we work with.
Yeah, I think that's the critical part is many people wanted to just get published, get out there. And sometimes they don't have a clear message or clear call to action yet. So just because you got yourself out there, if there's no clear pathway of that client or relationship journey, then the work and effort you did not necessarily going to lead you to something that's measurable result that you really wanted. So having people like you guys are very intentional about having the right interview, analyze it, putting in the right message before all the voices come together is very critical. And just like for us, we actually come together as Healthcare Amplify organization, wanting to make sure the right voices is in the forefront of innovation, especially clinicians. So you don't come back to us to say, hey, we built you something. This is going to help you go adapt. And then our mind goes just like our workflow challenge, right? I'm already tapped out. Why should I adapt this new screening tool or new thing that will help me chart better, right? It all sounds like great ideas, but how practical is it if you don't have those very detailed human conversations? Sometimes you can miss out things. But at the same time, when you are very clear, then yes, do more, speak more, right? We love to hear from people. And then people do consume information, but also with AI, with everything nowadays, you can search for what you need if you look, right? And then it's just the intentionality beforehand anything. So as a community, we love being connected. We love to help each other. So I always like to ask this fun question. For you, if we give you a magic wand and grant you 3 wishes for you guys as an entity, as a company, what would you use the 3 wishes on?
Wow, that's a heavy question. It's an exciting one, but man, there's the possibilities are unlimited. I think that I tend to get in some of the healthcare things from my vantage point, from a kind of a philosophical or a structural, perspective. And so I think one of the things for me, like I would actually, if you made me king of healthcare for a day, I would actually pull apart health insurance from your employment, right? So I think by taking employment off the table, it was well intended, right? People probably know the history of how healthcare got hooked up to employment in the first place, all the way back to World War II in terms of wages were frozen. And so people were able to put benefits into the stack, and that wasn't part of the equation. And so companies started doing that when they couldn't pay higher wages to people. And so ever since, we've kind of been tethered with this, your health insurance is tied to your employment. And I think that just limits the choice for people, right? Why should my employer be the one deciding which plans are available for me? Like, why is my rate based on the people that I work with? And so there's just kind of lots of strange things that come with that, that I think ultimately inhibit, again, choice and freedom and some of these, again, alternative models that people could be considering that might be better fits for their health. And so I think it just adds a lot of complexity. And I think we could free up a lot of human capital and probably a lot of dollars if we just put everybody kind of into, again, I'm not advocating necessarily for like a single payer model necessarily or anything like that. But I think getting it out of the employment model would just save us a heck of a lot of of work and effort. So I think that's a key piece. I think primary care, I think you could make an argument that primary care could be pulled out of the insurance model too, right? Like, what if primary care just became kind of a membership? Again, we've got some experience in working on some of these models that start to look and feel a little bit more like a membership. And we just see the real power that emerges when you're able to do that and take, again, that fee-for-service structure out of the equation. We see some of this stuff with like direct primary care models and some of these concierge models that are emerging. And I think there's a really interesting value that's there. But can we start to bring that together where now maybe that everyone is on some sort of membership model? And now the ability of my primary care physician to be able to help me manage my care, might play a part into what kind of rates I get on my health insurance and things like that. So I think there's a couple of really interesting sort of what if structural or statutory things that could be done that would make healthcare a lot more interesting and a lot more human in the way it's delivered.
Yeah, fun, right? Like how do we engage with people better and serve them and without the burden of insurance plans telling us how much is got paid and people worry about out of pocket. Things just make more sense when we shift the perspective of how we even engage with payment model. Love the conversation. We can talk more about this forever. And then I love to continue this for sure. Now, for everyone who wanted to engage with you, learn more about you guys, how do they find you?
Yeah, so you can find us at BarkleyOkRP.com or BarkleyOkRP Health Innovations.com. So our health innovations team is unique, especially for an agency. So Berkeley OkRP, one of the largest independent agencies in the U.S. But because of that, we can invest in adding some additional capabilities beyond just what you would think of from a brand and marketing agency. So from my background, I'm not an agency person by background. I spent 10 years leading strategy and innovation at Blue Cross Blue Shield in Kansas City. So our health innovations team is unique, where we've brought people together that have that industry experience to be able to go, again, a layer deeper for our clients. So we can, again, do a lot of unique and interesting things, as we've talked about today, that go beyond what you, again, think of from a traditional brand and marketing agency in the healthcare space.
Amazing. Love you guys. And thank you so much for the value share on a different perspective of how we will take the human experience for our clients, for our patients, as well as for the back-end administrative and clinicians all aligned together. Appreciate you joining here, Jason. And until next time, everyone. Thank you for tuning in to Provider's Edge podcast. We hope you enjoy our latest episode and found the insights and tips helpful. We'd love to hear your feedback on the show and learn what topics you'd like us to cover in the future. So please take a moment to leave us a review on your favorite podcast platform and let us know what you think. Your feedback is essential to help us improve the show and provide you with the content you need to take your healthcare business to the next level. Thank you for your support, and we look forward to hearing from you soon.